Hi, this is Dr. Sonia Nayyar. I'm a neurologist in Apple Valley, California, and I'm associated with Choice Medical Group, Choice Physicians Network, and Horizon Valley. I wanted to talk today about the coronavirus, better known as COVID-19. I know there's a lot of posts, blogs, and things out there, but I kind of want to talk about things that we could to prevent it, because I think that unfortunately, because of the lack of testing and strict criteria, our numbers are grossly underrated. So I first wanted to talk about how we could control it.
Hi, my name is Rishi Nanda. I'm a recent college graduate with neuropsychology and biomedical science. And yeah, I'm here with Dr. Nayyar to be discussing COVID-19 and the idea of socially distancing and self-isolation.
So, the number one thing I wanted to talk about is really the panic. I feel like, unfortunately, there's been a mass panic and mass hysteria that's happened. And one of the best places that we can really see it is, unfortunately, the grocery stores. And I think I want to remind people that we should not be hoarding materials. We really should be only taking what we need for that week or what we need for our family, because there are certain people out there, they're sick, the elderly, who really rely on specific food groups. And if they go to the grocery store and can't find it, unfortunately, they're left with very little options. And, some things that we can do to help our community offer, if we have elderly neighbors, elderly friends, offer to get them groceries. They may be too scared to go. Other options is, we still have a very, very small local community. We really should be supporting their businesses. So getting gift cards, ordering takeout from them can really help them during this time of panic.
No, exactly. I think we should also be considerate of the individuals who maybe won't be able to buy things in bulk, due to their financial situations. So I think, like you said, it's important to just buy what's absolutely necessary at the time and what you really need in that moment.
And, that takes me to my second point. So social distancing. So we've all heard about social distancing and trying to flatten the curve. And what that really means, I know Governor Newsom went over it a little bit yesterday, but we really should not be leaving the house unless it's for essential work, emergent doctor appointments, or the grocery store. I think we also have to remember that we are coming up on spring break. And while I know that this traditionally is a very fun time, people go to beaches, we should not be traveling by car, train, plane, or anywhere. We really should be staying put in our house, because we could potentially be asymptomatic and infect people as a result. So, the other thing I did want to touch base is that there's this misconception that this is a disease of the elderly. Actually, here in the U.S., we're having an increasing rate of 20, 30, 40-year-olds, very healthy people being intubated. So I think we have to remember that it's all of our priorities to keep everyone safe, no matter what the age group.
No, yeah, exactly. We live in the age of technology now, so I think interacting with your friends, families, relatives, or anyone really is not that hard. So yeah, so when I see my peers out and about, especially during this pandemic, it's definitely unnerving and disappointing. And then seeing, like you said, spring break, the beaches were packed last week. So I think not everyone understands the severity and seriousness of this issue. So I think this is definitely everyone's public service announcement to please socially distance yourself, self-isolate, do anything. And obviously please remember to wash your hands, sanitize regularly. And so definitely, if it's not possible, obviously 6 feet apart from everyone. That's what CDC is recommending if you have to go out due to work, grocery stores. And so yeah.
So we're not following the 6 feet rule right now,
Yeah.
but usually 6 feet is a pretty considerable amount.
Exactly.
So please remember that. And the last thing I really want to touch upon is masks. Unfortunately, a lot of our healthcare professionals are running out of masks, and what people don't realize is the number of people that are used to run a hospital. We don't only have physicians, nurses, mid-levels. We have the environmental staff, the nutritional staff that are working nonstop to help us. And unfortunately, because some people hoarded them in the beginning, we're running out of masks. And so even though we're seeing multiple patients with positive findings, we cannot protect ourselves and therefore infect further people. So, if you have masks, if you guys are not using them, please consider calling your local hospital to donate to them. Also, people who are not working right now, dentists, construction workers, painters, they tend to have N95 masks or other masks. Please consider donating them, because as a society that would help us all. We've actually been told that if we run out of masks that we should be wearing handmade masks or bandanas, and I think that really is a last resort. So together, I think with all of these things, we can really try to contain the virus.
No, yeah, this reminds me of an example. My friend recently tested positive for COVID-19. And like you were saying, it's not only for elderly people. The young people should like take this seriously, because he was mentioning some of the symptoms that he had, and he said the muscle fatigue was so intense that it felt like he just did like a strenuous workout, or that his shortness of breath was so bad that he felt like he was gonna pass out. And these are, like, you know, some of the mild symptoms too. Like, they can get pretty intense as well. So I think it's important as young people, take this seriously. Like, socially distance yourself if you can, self-isolate, take all the necessary precautions. I think this goes without saying, but all the healthcare workers like yourself, Dr. Nayyar, you know, you guys are the unsung heroes of our day, you know, so I think you guys deserve all the recognition and praise that you can get. And like you said, if you have N95 masks, please try to donate them to the local hospitals.
And, you know, lastly, what I want to leave everyone with, the entire medical staff and hospital staff are really staying at work for you guys. So please stay at home for us. Thank you, Rishi.
Thank you, Dr. Nayyar.